So welcome everyone to the 2022 Geriatric Case Competition Orientation. I am Max Sabatsky, the person who has been probably in frequent correspondence with many of you the last 72 hours. You probably recognize a few of the other leadership names on the call. You'll know your coaches very well shortly, but thank you so much. I know we've had a lot of great marketing for the event and for all of your participation, and whether this is through voluntary participation, through course assignment, through service project, or out of the goodness of your heart of loving geriatrics, all the above. We're really excited to have you here for this event going on. So this is our yearly competition that we have, which is sponsored by the Gateway Geriatric Education Center, also through our Geriatric Workforce Enhancement Program grant, which we'll discuss a little bit more. So many of the skills that you're learning and involvement is a major part of our grant this year, as well as for just the development of geriatric skills across the university. So we're really excited to have you here. As you know, this is also being recorded. So for those who can't make the competition tonight, you'll be able to play the recording back and be able to see some of the details that are happening with the competition. And feel free to contact us if you have any questions throughout the way too. So first, we'll give some introductions on the main leadership team. Just a brief intro of myself. I direct the medical family therapy program. I've seen we had a lot of mental health students that signed up through MedFT social work psychology this year, so that's great to see. But I work with a lot of disciplines across the university, and also the associate director in the Geriatric Education Center, and also help out with the Health Resource Center. So I see many of you both in the open clinic and in the geriatrics clinic. We have a big thanks to several people here. So I'll kind of go down the list. First, Matt Pigeon, you want to introduce yourself? He's been the lead scheduler of the event and helping to correspond with the students, coaches, and judges. So can you give an intro, Matt?
Hi, it's nice to meet everyone, and this is my first year participating too, so I'm excited, and it's been a fun process along the way. So I'm sure you'll be hearing from me quite a bit throughout the competition, and if you have any questions, always feel free to reach out.
Excellent. Marla Bergweger has been a huge part of this with the Communications of Minnesota. She's the PI on our GWEP grant and helping on the back end with the setup, and since this all started. So
thank you, Max. Welcome everyone, and thank you for your participation. Just to echo what the others have said, we look forward to this event every year. This is, of course, our 7th year, and it's really a great opportunity, I think, for all of you to interact with the other disciplines and learn more about what they do, but also to put together a plan for a complicated case. So we thank you. And just to reiterate what Max said, anything that you all need, please reach out to us and let us know. So excellent. Enjoy.
That's right. Yes. The most important thing is have fun with this. There's going to be a lot of great interdisciplinary work, and we're going to be excited as coaches to help out, but obviously this is fun too. And yes, as a technical competition, there's cash prizes, but we want to have fun too with it. So Kelly Hawthorne has been on the steering committee and also provides some updates in the handbook, which we're going to be sending out to students. Has been a big help as looking at some improvements on the cases here. So Kelly, if you introduce yourself.
Sure. My name's Kelly Hawthorne. I'm a physical therapist by training, so I'm glad to see that there are some PTs, OTs, speech paths on the call tonight. Yeah, I've had the opportunity to participate in a number of ways as coach and judge in the past, and I'm excited that this year I was able to be a part of the steering committee. So I'm looking forward to interacting with everyone, and I think it'll be a great competition.
Wonderful. Thanks. Yeah, some great turnout from disciplines, and I know we tried to diversify the disciplines on different groups. So all of you have your skill sets and work together to learn from each other. So yes, Kelly's a wealth of knowledge in the PTOT space. And then we want to give some thanks to the University of Minnesota GWEP members, Chris Talley, Teresa Schicker. They have been instrumental in not only helping collaborate with the inner GWEP, which we'll talk about, but also elements of the case and helping us as well with some tips and filling in some gaps. So it's been a great collaboration. This is our third year of doing the inner GWEP with the University of Minnesota. We're not obviously looking at history too much, but Minnesota won the first year, we won last year. So there's been a split. So obviously we hope to win this year, but again, fair competition for all. So in addition to introducing everyone, the main point people, if you wouldn't mind maybe putting in the chat the students and coaches, just your name, your discipline, what year you are. I know we have the group splits, which we'll talk about the breakout rooms in a little bit as well too, but feel free to get that chat rolling and enter in, again, just name, discipline, year you're in, just so we know and can track. And that way we can see kind of everyone going on the competition and we're all involved that way. So, oops. Want to put a statement out there, which again, our apologies ahead of time. I spoke with Minnesota this morning, and I know with the observance of Rosh Hashanah, we wanted to just put out there that for any students that are in observance that couldn't make it tonight, we completely honor that. If there are any that technically don't feel like they can work during this day and need to observe that, we completely respect that. So we wanted to be in observance of this, and you can plan accordingly with your team. So we want to just put that out there. And again, our apologies. We set this up months ago and try to line up calendars and schedules and dates the best we can. But again, thank you definitely for everyone being able to show. All right, so let's get into the specifics of the orientation and about the case competition. We'll kind of outline some things for this next month or so, and then just talk about the timeline for the team that makes it to the inner GWEP competition. So some of the goals for orientation, obviously meeting the leadership committee, but also your team and coach. So you'll get a chance to talk with the breakout groups, your team, and focus on that case. All of you got the breakdown of the group in the email. We can send you another email if needed during this call or as we get close to the breakout groups. Learning about each other's focus and expertise, and while reviewing the case, you can talk about what discipline and experience you have working with geriatrics, working with older adults. We feel we have a great cases here. We've worked long and hard on getting some diverse disciplines and health interests in there. So I think there will be some low-hanging fruit that many professionals and those out there can work with. So it should be really good lined up. Developing a plan then will be from tonight, and we'll really emphasize the teams that meet quite often in this competition tend to do better. That's not to say that you have to meet many times, so we understand there's a lot of challenges during the scheduling during the year. Obviously, the committee understands that, but if you make it an intention to want to meet and really put some effort in the case, it can really show some great rewards. And ask questions and clarify the process. So in addition to stuff you are putting in the chat about your name and discipline, if you have any questions, you can use the chat box as well during the next half hour, 40 minutes or so. So as far as the HRSA Geriatric Workforce Enhancement Program core areas, there's many that are out there that we cover. Certainly the age-friendly health systems, wellness and safety are two big areas that we do. So Marla leads all the initiatives on our GWEP grant and many areas that we train and educate, not just students, but professionals and providers across the state of Missouri. And now we've really hit nationally and even internationally. The bottom two really are some of the core areas of the competition. that really fit within what our mission is of the grant and the GEC. So education and interprofessional training, along with developing a future healthcare workforce in geriatric care. We've had many past students, graduates say how valuable this case was, even that if they weren't on one of the winning teams, that they said that it was great that they gain skills. And even when they're working with older adults in practice in their residency, in the healthcare workforce, in any type of career or skill set, it's been really, really valuable. Especially working with an interprofessional team has been extremely helpful too. So not just the skills, but working on a team together. So we're trying to meet several of those competencies and offer that training to all of you through this. So, you know, with the case competition, these are really the outline areas that we look at. So as you're developing your education training around geriatrics, these are sets of interprofessional teams that we have. We have 13 strong teams this year. So each is designed to develop and prepare a case so that when you present this to the judges, you can have a comprehensive plan of care. Also talk about how you're working interprofessionally, kind of a reflection part for the last minute or two at the end of the competition. Faculty coaches will be available for consultation as needed. So as we mentioned, feel free to talk to not only the coaches, but if you have questions for the committee, you can contact us at any time. And approximately 1 month to meet and develop a plan. So I know it sounds like, you know, 1 month's a long time. Trust me, when 2 weeks goes by and you're halfway through, your team will want to find a way to meet quickly. So I would say tonight or right after, find a way to plan often. I know many of you have group chats, new apps, technology. I know that's probably getting invented by the month that I don't know about, and I learned from students new things. So feel free to do that. Those are great ways to connect with each other. The disciplines participating in the competition, obviously there are a few others which we cross over as far as our specialty areas, medicine, nursing, dentistry, OT, PT, pharmacy, the mental health disciplines, speech, language, hearing, nutrition. So we have some great initiation and representation this year. Again, one of the goals is not only to learn from other disciplines, but really you can do some of your own research to see some tips that you can learn, interventions and skills, cross-cultural areas, working with the patient system or the family system. So, you know, get to know what other disciplines do is really the learning, one of the big learning lessons and takeaway points that we emphasize in the competition. So as far as the competencies that we track, obviously working together, a climate of respect and shared values is something that we honor. We're going to put a few of the links in the chat before you do breakout groups. So we want you to just fill out these links live at the orientation tonight. And so you get to assess your own competencies right now, and then we'll do a post assessment after the competition is done. We're also tracking the knowledge of your own roles and that of other professionals to assess and address healthcare needs, really of older adult patients, the ability to communicate with others, apply the relationship building values of team-based skills and team dynamics. So, you know, this isn't only a nice plan of your discipline, but also a comprehensive plan. Does it make sense? Are you honoring not just the family system, but you're honoring the cultural, the financial, the sociological, the socioeconomic pieces of where the patient family are situated? So those are some important things you want to make sure that you're incorporating for competencies. So as far as the main directions, after tonight, this will be your, I guess, automatic homework, is you'll have a plan of action, work with your coach as needed, and you're off and running. So making sure that you review the case. There should be something for team members in any discipline. I think what we did this year is we intentionally put sections of disciplines where there are several things that cover the majority of disciplines. So not only is something listed there, but you can look in other areas and see what crosses over too. So something that may just be in the nutrition section could also be in biomedical information. If you're seeing something psychosocially, how could that overlap with the presenting issues or what you find in labs? So a lot of sections can cross over to each other that you see in the case. And obviously you're creating an interprofessional team. Not only can you use your coach to help out during this next month, feel free, if you want to reach out to other providers, that's great. Look at evidence-based research. We'll give you a few tips on past YouTube geriatric competitions, but if you want to look at other information, feel free to. So the internet is your oyster, I guess, but make sure you find out credible sources. That's an important thing too. The third point is really the most important thing, placing the patient and the family at the center of the team. Oftentimes, I think as providers, we use either a top-down approach or a very direct delivery model. But one of the things with this competition we want to emphasize is, this patient and family are struggling with a lot of issues. So if you're working on a team together, how can you work from more of a flat hierarchy? Work as the full system. You're a participant in the patient family's care, but you're also honoring their voice and their agency to make decisions as well too. So that's really important, is working together, kind of striking that dance between what the patient and family need and what the providers can really offer, and making a plan that's effective for teamwork and communication. You want to make a plan that's reasonable. So obviously offering 37 interventions is probably going to be a little unrealistic for a family, for a plan, although tempting, and probably a lot of things you want to incorporate. So, put enough information in there, but just enough and not to go overboard where you feel you may overwhelm the patient family, and it's realistic in real life. So as far as the case, kind of envision maybe what Charlotte Kenny would look like, but obviously we just needed an image. This is a 71-year-old female living in a rural area of Missouri. You can see from the details of the case that she's coming in for a chief complaint of back pain. Obviously, there's a lot more to the story of that. We put in some psychosocial and health history to impact the overall case. The fourth point, where the patient is a former veteran, is going to be a really important detail. So that's something where there's a section in the case that you'll read, and we gave some information and resources around a former veteran and just the connection and how that ties in with some of the presenting issues the patient's going through. So we just say keep the patient's family and social connections in mind for the plan of this case. Obviously, we're not going to give away too many hints here, but these are just some of the overview points that we want to express and share for Ms. Kenny as you're working with her and her family or other social connections during the timeline of the case. So when you're working together, you form a care plan. So this is developing a comprehensive care plan. Again, as many areas as you can that not only fit within your discipline, but maybe disciplines that aren't representative on your team. Really go through and analyze the case, break this down. Teams in the past have said we read through it 3 times. Sometimes the 4th and 5th time when we reread it 2 weeks later, there's more things that come to light. And we want to add in. That's good because there's going to be a lot of information here. So you want to identify the team members who you can assign for certain areas of the case, but you also want to make sure that you're covering some information. Again, use your coaches. They are going to be coached at not to give you necessarily direct answers, but be able to facilitate in a direction or think about some perspectives. Although tempting for us to be able to give some of our words of wisdom, we want the team to really work on this a lot. Explore potential interventions and community resources. So be able to provide some of those evidence-based interventions, family-centered skills, maybe some community models of care that really help the patient and family member get through the case. Again, make sure that they're reasonable. Make sure that you're understanding certain areas. Obviously, health equity, health literacy, those are big areas you want to consider too. What does the patient family understand? What can they manage, and maybe things that it would be a little bit more challenging for them. And then plan an evaluation and a care plan. So being able to say, after you presented the issues, discuss through some of the things in a timeline approach. what would be your overall evaluation you would have of this? I did mention on here, you want to save a few minutes at the end for your reflections. And if you run out of time, maybe the judges will ask you around that, because that's important. We want to know your overall reflections of the case and what you got out of it. That's some of the fun of doing this, and being able to express that and making sure that the judges really know about that too. That often helps. So the presentation and judging of the first round, 20 to 25 minutes, usually the 20 minutes with a few minutes grace period, but we give a cutoff point so that we can ask for questions, followed by about 5 to 10 minutes of Q&A. So really budget your time accordingly. You're going to do all this work, and you have to condense this down into about a 20 to 22 minute presentation. So that's kind of, it's opposite in academia, where you need to expand papers, expand presentations. This is reducing it and really being concise and to the point. It's important that everyone on your team participates, so that you kind of spread the wealth as far as who's talking and sharing not only the information and content, but the reflection of your experiences. And presenting the summary, plan, and reflection, make sure that you balance that during that time. Again, it goes really quick. So there's going to be a team of 3 judges per team. So once we're on Zoom, it'll be like this. So there'll be 3 judges looking at that, and each presenter will kind of go back and forth within the team. We'll kind of give obviously a time limit for there, but we're really looking at the application, the material, and the content, developing an appropriate plan, and really evidence that there's good team-based skills and what you're learning. Creativity is also a huge element to this. So you can also have fun with this. Some teams in the past, presented as far as how team members' roles would be, or a specific group, and how they're kind of working together, synonymous with the case. So, be creative in how you want to present this. Again, there may be a little bit on creativity, but, obviously the meat of it's going to be the content plan and working together as a team. As we mentioned, there's also some dissemination on YouTube. There's past winners of the competition. So there are good models as far as what's out there. You can see from the past competition, we did have an in-person awards from years ago. I think this was, gosh, six years ago, maybe 6-7 years ago. So unfortunately that we don't have a little bit of the buffet spread here. We can give acknowledgement to the award winners, but I think there is some accessibility benefits of doing some things on Zoom now. So again, we have a lot of great topics. Informational videos are there. You can also check out the Aging and Memory Clinic website at SLU. I know myself, Marla, several other of the faculty have given some great talks and PowerPoint slides on geriatric health, loneliness and isolation, memory loss. There's even some stuff, I think, on hoarding and cluttering, and other areas too, fall risk. So some good things on the GEC website and also on the Memory Clinic website as well, in addition to YouTube. So the case competition, this is the scoring system from what it looks like, and I will give what the rubric looks like in a little bit. So the scoring is really not at all, to a small extent, some extent, great extent, or consistently and expertly given. So it's a general rubric, and I will see if I can stop share and reshare a copy of the case here. Hold on one second. Let me see if I can find it. So I just am going to try to show you a copy of what that looks like, because it'll be important just to see from the scoring system, what we look at and what's out there. So we'll try to field some questions as well too here. Okay, if everyone can see that, this is what the judging rubric will look like, and we'll send you a copy of this, obviously, so you have this and what we're going to be judging you on. So, the composition of the team, and naming at least 5 professions that'll be involved in the case. I think there may be a few groups that have 4 people perhaps, so I think the majority of this year will hopefully have at least 5. But expect to roll in contributions. The patient and family is part of the care team. Then we get into the care team meeting the patient's care needs. So obviously having a care manager who, would take the lead, but also how you're working together. We have several benchmarks as far as the relationship between effective teamwork and improved safety and health outcomes. So obviously involving the professions and how you have innovative ideas, identifying and address some safety issues. There will be plenty in the case. Methods for tracking treatments and outcomes of the case as well. This is a big section is illustrating the interest of the patient and family at the center of the interprofessional team in health delivery. So using humanistic language, obviously addressing caregiver or family health, identifying a clear plan, the ways you can build trust. So obviously, again, it's tough within the 20 to 25 minutes to hit, but I think this will come naturally for really good teams that you establish a really good base for your plan. Describe how the student competition demonstrated effective interprofessional team skills. So you talked about any strategies, maybe used other forms of technology, had team meetings, that's part of the reflection. Any ethical considerations, and especially the lessons learned. That's always helpful. And then just overall presentation skills. So effectively introducing yourself in the case summary. Is it organized? Does it have some good visuals? I think some of the best presentations in the past, and certainly, Marla or Kelly can correct me if I'm wrong, the visuals and some of the things, whether it's graphs or timelines or things, really help. I think that shows creativity, or even models. Sometimes the visuals are really helpful for those that are presenting on there. So, and then we usually provide some feedback, as far as what really went well in the case and what's there. So, and again, feel free if you want to put your questions in the chat box around that. We'll try to address that later on. So again, I mentioned this as far as the scoring. These are kind of the main areas, again, that you'll see that on the rubric. So you'll get an insight for what the judges are looking at and what's really consists of with the competition overall. But in addition to meeting as many benchmarks as you can, really the creativity and preparation we can see. So again, those that put the effort into it and do well, we're confident you'll have some high scores here. Just the timeline then to show you, obviously you saw the initial flyer, you got a copy of that. All groups will be presenting that night. You'll have 30 minutes, again, about 20 minutes or a little bit plus for the presentation time for Q&A. 2 weeks after that, and shortly after the semifinals, we'll let the winning team know. We'll obviously let the top 3 winning teams know, and and email everyone there. And by the way, the winning team gets recognition. We get through NewsLink, and we disseminate that at SLU. So your celebrities automatically, if you win the interguep, then you hit rock star status, higher than that. So. So yeah, 1 week after the semifinals, the winning team from SLU in Minnesota will convene on Zoom for the interguep competition. That's where the steering committees from both sites as judges, and then prizes are given to the top 3 teams through SLU. We do ask, in addition to tonight's pre-assessment, that there's a post-assessment of interprofessional competencies. So we kind of track a pre-post. We continue to do that. It's relatively painless, and it's on Qualtrics. I put the consent form, the demographic form, and the pre-test in links, which we'll put in the chat. So we'll give a little bit of time in a bit for you to fill that out, and then we'll come back and do the breakout groups. So final tips, and then I'll be quiet, and any questions people have, or through the chat or audio, free to do so. Make sure that you meet at least twice prior to your presentation for your plan. So if you want to count tonight, I guess, but I would strongly encourage that you do it twice more. So whether it's on Zoom, you can get together in person. It's a little easier in 22 than in 20 and 21 when we were really doing things fully remote. Use your coach for any questions. We have some wonderful coaches out there that we have from speech, language, nutrition, nursing, medicine, OT, PT, pharmacy, social work, psych, MedFT, all the disciplines. So really use your coaches, and again, any professionals out there, it really helps. And have fun as far as collaborating with anyone else that can help you. Again, make the plan realistic. So I know you only have 20 minutes plus to work out a plan, but something that's to the point, that's creative, but that really can advance the patient and family in this case. So have fun with it, but make sure it fits all of the needs that they have. Keep the family in mind throughout the conceptualization. Stay family and system-centered in your care. And again, have fun. This may be one of the few opportunities you have through an assignment, a service opportunity, an outreach opportunity to do this. It's a unique and awesome way to collaborate with other disciplines. That's often not through a conference or other means as well there too. So, all right. So the three things that we'll put in the chat box, and actually, I'm just going to field anything in the chat, and if I missed anything that the committee caught, feel free to catch anything.
Max, I put the GEC website and the Aging and Memory Clinic website links in the chat, but I don't see any questions or comments, just lots and lots of introductions. Thank you all for doing that.
Okay. Sounds good. Oh, good.
Oh, you covered everything extremely well. So appreciate that. Maybe that's why there are no questions.
Okay.
Oh,
We stumped everyone. Yeah. No.
We have one question. And I don't know if you could probably see him as well. Is the judging rubric available for us to review?
Yes, definitely. We're going to be sending it out to the team. Actually, if I have a PDF, I can put in the chat so you can see it. But yeah, when you're doing the breakout rooms, I'll send that just to the full group, and you can pull that up just to see. So when we do the live links in a second, we'll give you some time, and maybe I'll send that to the group while you're doing that. But definitely you'll have access to that. So good question. Any other questions for the chat, or you can unmute yourself if you're.
Another question, can we have these links in the rubrics emailed to us?
We can, yes. So I'll send you a PDF sheet. Ideally, we're trying to save about 10 to 12 minutes now. So if you can complete the links, it's done for the questionnaires. But yes, the links for that, we'll also send a PDF, and the rubric. We will send both of those as well. So.
And just to provide some context, the demographic form and informed consent are grant requirements for us. The self-assessment is helpful, but the other two are actual grant requirements. So please be sure you fill those out.
Absolutely. Hold on one second. I had this information sheet. Hit this right here. There we go. Okay, so I am going to put the three in the chat if this works. Hopefully it does. This is the demographic form through SLU. This should take you to the demographic form right away. If you have any problems, I'm going to send you the PDF copy as well. This is the consent form. So as Marla said, that's a requirement for us for the consent form is a biggie, and that'll be really quick. You just put in your name and date that you agree to it. Then there's the interprofessional competency questionnaire. So that's just probably the longest one. That's just our pre-test. So you have all these forms. We'll kind of just go on a little bit of a silent break here, maybe about 12 minutes or so. So we'll give all of you a chance to click on each three. Again, the demographic form just is your personal info that you send to us. Correct. Yes, good question. Geriatric Case Competition is the name of the event. That's good. It means it's working. So that's the name of the demo form. Consent form, again, name, date. Once you agree to that, submit it. And then the interprofessional, again, this is the pre-test. So everyone's doing the pre-test at the top. There's 20 or so quick questions. We'll come back probably at 6:20 Central Time, and then we'll just kind of wrap up. Again, I'll send the PDF of these, but if you can do it on the fly, you get rid of it and you're done, and then we'll get it to the breakout rooms if that works. So yes, coaches do not have to do the IPEC questionnaire or the consent form. The demographic form, if you have not filled one out, would be helpful from the coaches. I assume anything that we can get from anybody is helpful. I don't want to speak. I would assume if everyone can fill that out, but so okay. So we'll see you back at about 6:20, and yeah, have fun with the forms. So stay on, don't leave, because you got to hit your breakout groups.